Assalamu alaikum wa rahmatullahi wa barakatuh, dear colleagues and friends. Hope that you are all doing well and fine. It's only 10 days before the start of November exams. I hope that you are ready. Do as much effort as you can in the next few days, and definitely it is an easy exam to pass. Today we are going to discuss a very important lecture about the lay examiner marking sheet. What's needed from you in the exam to satisfy the lay examiner and take an easy marks. Almost 30% of your marks in the exam will be from the lay examiner. 4 or 5 tasks in the exam, you will find a lay examiner there. So this is a gift for you today. What's needed to be mentioned in each task when you find a lay examiner there to secure the marks of the task. But before starting this lecture, which will not take much time, it will take few minutes, I will take the chance to wish you all that you feel safe in between your family and friends, because safety and peace now are among the blessings that our people are missing in Palestine. They are missing the safety and peace in an unjust world ruled by gangs of tyrants and oppressors. Today's lecture will not take much time despite its importance, so I will add 2 or 3 minutes as a form of support for our people in Palestine who are killed every day under the eyes of the world, who tries to hide the effects of the crimes of the Zionist occupation. We will not accept normalization with the Jews who occupied our land and are trying to erase our history. The history did not mention anything about the existence of what's called Israel before 1948. So I'm asking my friends and colleagues here who don't know much about the case of Palestine, please go and search the maps of the world before 1948 and before the promises of the colonial countries, and you will not find anything except Palestine and Jerusalem. You will find only a green land of peace, the land of the birth of most of the religions. But as a form of documentation and the support of our brothers and sisters in Palestine, I apologize if I'm going to speak for 2 or 3 minutes in Arabic. This is a form of support and the weakest of faith, which I cannot provide them with anything else except it at the moment. I don't know, it may end by the video being deleted or the channel being closed, but this is the least thing that I can provide as a support for my friends now is to publish their case. So, اغضب فإن الله لم يخلق شعوبا تستكين. اغضب فإن الأرض تحني رأسها للغاضبين. اغضب فإن حدائق الزيتون لا تأتي كلاب الصيد لا تنسى دماء الراحلين. الأرض ترتجف وتحزن حين ترتجف النسور ويحتويها الخوف والحزن الدفين. الأرض تحزن حين يسترخي الرجال مع النهاية عاجزين. اغضب فإن قوافل الزمن الملوث تحرق الأحلام في عيون الصغار الضائعين. اغضب، ارفض زمن العهر والمجد المدنس تحت أقدام الطغاة المعتدين. اغضب ففي جثث الصغار سنابل تنمو وفي الأحشاء ينتفض الجنين. اغضب فإنك إن ركعت اليوم سوف تظل تركع بعد آلاف السنين. اغضب فإن الناس حولك نائمون وكاذبون وعاهرون ومنتشون بسكرة العجز المهين. اغضب إذا صليت أو عانقت كعبتك الشريفة مثل كل المؤمنين. اغضب فإن الله لا يرضى الهوان لأمة كانت ورب الناس خير العالمين. اغضب إذا لاحت أمامك صورة الكهان يبتسمون والدنيا خراب والمدى وطن حزين. اغضب إذا لملمت وجهك بين أشلاء الشظايا وانتزعت الحلم كي يبقى على وجه الرجال الصامدين. اغضب إذا ارتعدت عيونك والدماء السود تجري في مآقي الجائعين. اغضب إذا لاحت أمامك أمة مقهورة خرجت من التاريخ، باعت كل شيء، كل أرض، كل عرض، كل دين، اغضب ولا تترك رفاتك جيفة سوداء كفنها عويل مودعين. اجعل من الجسد النحيل قذيفة ترج أركان الضلال ويشرق الحق المبين. اغضب إذا لاحت أمامك صورة الأطفال في القدس ماتوا صامدين. فالأرض لا تنسى صهيل خيولها حتى لو غابت سنين. الأرض تنكر كل فرع عاجز تلقيه في صمت تكفنه الرياح بلا دموع أو أنين. فالأرض تركع تحت أقدام الشهيد وتنحني وتقبل الدم الجسور وقد تساقط كالندى وتسابق الضوءان، ضوء القبر في ضوء الجبين. وغدا يكون لنا الخلاص، يكون نصر الله بشرى المؤمنين. اغضب، إن بداية الأشياء أولها الغضب، ونهاية الأشياء آخرها الغضب، والأرض أولى بالغضب. سافرت في كل العصور وما رأيت سوى العجب. شاهدت أقدار الشعوب سيوف عار من خشب. رأيت حربا بالكلام وبالأغاني وبالخطب. رأيت من باع الضمير ومن تآمر أو هرب. اغضب فإن الأرض يحييها الغضب. اغضب ولا تسمع أحد. قالوا بأن الأرض شاخت أجدبت. منذ استراح العجز في أحشائها نامت ولم تنجب ولد. الأرض تحمل فاتركوها الآن غاضبة، ففي أحشائها سخط تجاوز كل حد. تخفي في أساها من عيون الناس تنكر عجزها. لا تأمنن لسخط بركان خمد. لو أجهضوها 1000 عام سوف يولد من ثراها كل يوم 1000 غد. اغضب ولا تسمع أحد. اسمع ضميرك حين يطويك الظلام وكل شيء في الجوانح قد همد. إما أن تموت فداء أرضك أو تباع لأي وقت. مت في ثراها فإن للأوطان سرا لن يعرفه أحد. إن تنصروا الرحمن ينصركم، وهذا ما وعد الرحمن، هذا ما وعد. ألا إن نصر الله قريب. So back to our lecture. Today we are going to discuss what's happening if you enter the booth or the cubicle and you find 2 examiners with the role player there. If you find 2 examiners, it means there is 1 clinical examiner and 1 lay examiner. We discussed in the course and in the previous lectures in each task what is needed by the clinical examiner. In each task there will be a different marking sheet, but the marking sheet of the lay examiner will be almost the same in all the tasks. As I mentioned in the introduction session, when you are going for bar 3 exam, it is an easy exam, but you need to act. You need to know what's your script in the movie inside the cubicle. So it's a movie. As a movie, we are living in it in our world. So it's a movie, so you have to act your part. So what's needed from you? There are 4 domains. Any domain can be tested by the lay examiner, but mainly the lay examiner will evaluate your communication, your information gathering, sometimes patient safety, and clinical knowledge will be evaluated also by the lay examiner. So in the information gathering, what's needed from you in the exam? You need to explain the reason for the consultation, and you need to show what's meant by history taking. So many of the candidates, they will miss the aim of the consultation. Either you have to explain to the patient why you are here, why you are in the consultation, or if it is not clearly mentioned in the candidate instruction, please ask the patient, how can I help you today? So you need to explain or justify the reason of consultation. The second point, you have to establish and address the patient concerns and expectations. This is called breaking the ice. Ice means ideas, concerns, and expectation. So if you remember our template, we are usually starting by introduction and rapport, then confirming the aim of the consultation, then asking the patient about her concerns or expectation. That's why I'm always asking everyone here to follow the template that we give in the course. In the candidate instruction, it is written that the consultant is not there, the consultant is away because he is in the theater or he is in sick leave. Please write it in your handheld notes. because if you did not apologize that the consultant is not there, and if you did not take a permission from the patient to continue the consultation, it means you will take borderline in the information gathering and borderline in the communication, because this is a very important point. So please, if you didn't mention this point, you will take a borderline in the information gathering or in the communication, because the patient is here to meet the consultant, not to meet you, so you have to take her permission to continue. If the patient is angry because she is waiting for a long time, or she is not satisfied with the service, or the patient is embarrassed for any reason, you have to identify this and you have to apologize. You have to absorb the patient anger and you have to encourage her to speak. If the patient is scared because of the explanation, you have to make sure that you explained everything and you identified that she is scared. The exam, please do not go according to your agenda. So you have to ask the role player or ask the patient questions, encourage her to ask a question. Do you have any questions so far? You have to stop in between and ask the patient if she has any questions. The role player knows the task and she will be instructed to ask you a questions that will guide you to the right track. So ask the role player if she has any questions, and if she asked you any questions, it means there is a mark here, so you have to stop and answer her question, because here there is a point where you will get a mark. Always, please, in the information gathering, use a combination of open and closed question. This is a common mistake, and I observed it in the mock circuit that we conducted over the past month. So many candidates are using only closed questions. So once you start taking the history, ask the patient, can you tell me more about your problem? This is a way of asking an open question. If you are moving to the obstetric history, can you tell me more about your delivery? Can you tell me more about your menses in the gynae history? So this is a way of asking open question. You can use also how and why. Give the patient a chance to describe their concerns and their preferences. Then you can fill the gaps by asking closed questions that the answer will be yes or no. And you have to check the understanding of the patient in between. You have to ensure that the patient is understanding what you say and provide her more information if she's asking for more explanation. So all these points will be in the information gathering marking sheet of the lay examiner. So if you covered it, you secured 2 points in the marking sheet in the information gathering in this task. Now coming to the communication. This is the second domain that will be extensively evaluated by the lay examiner in addition to the clinical examiner. Your English should be simple English. Use simple English. Chunks, not junks. Please do not consume the time explaining so many things without stopping. Please avoid using so many medical jargons. Medical jargons means you will take borderline in the communication. Even if you wanted to use a medical jargon, you have to explain it, because there are instructions to the role players. They will stop you and ask, what do you mean? So please use a simple English, use small sentences in chunk, not in junk. Common mistake, and it is a catastrophic mistake. Under the stress of the exam, so many candidates will forget to introduce themselves by name and role. He will start the consultation without telling the patient, who am I? I'm Dr. Surur, one of the doctors in the outpatient clinic today. I'm Dr. Surur, one of the doctors in the labor ward, in the postnatal clinic. So you have to identify yourself by name and role, otherwise it will be a big failure in the communication. You have to establish a rapport. Everyone here in his own clinic will establish a rapport between him and between the patient in his own clinic. But in the exam, I don't know why most of the candidates They will not say even hello, how are you doing today? You have to put the patient in ease. You have to encourage a dialogue between you and between the patient. The exam is not only about verbal communication. It is a combination of verbal and non-verbal. Verbal communication, you have, as I mentioned, you have to use a simple language. You have to, in between, to say the patient, I see, okay, I understand, together with the non-verbal communication. The non-verbal communication will be extensively evaluated in the face-to-face examination. You should keep an eye-to-eye contact with the patient. You have to show a body language which is welcoming. Avoid closed body language, which will put the patient in a difficult situation and she will not be easy for her to open a dialogue. So please use a combination, use a body language like nodding, like saying, I see in between. This will be very impressive for the lay examiner. Always use language that conveys empathy, compassion, and respect for the patient. Avoid undermining and avoid non-judgmental approach or criticizing the patient habits or circumstances. So these are the points in the communication. If you covered these points, if you act, as I mentioned before, part 3 is an acting exam. These points in the information gathering and the communication will be extensively evaluated by both the lay examiner and the clinical examiner. So if you find a lay examiner, this means the information gathering and the communication, at least you will have 8 marks here. So imagine 8 marks are in one task. 4 of them, if you are acting in a good way and you are following these rules, because most of the lay examiner tasks will be only evaluation of the information gathering and the communication. In some cases, there will be also evaluation of the patient safety and the clinical knowledge. What are the points of safety? You have to reassure the patient about her current condition and reassure her about the future plans. So please reassure the patient. For example, if you are in the maternal medicine module, definitely the patient is having a high-risk pregnancy, but you have to reassure her first. Let me tell you that ladies with diabetes in pregnancy, most of them will have a normal pregnancy, normal delivery, but some of them may have some complications like 1 and 2 and 3. And give the patient the complication in non-alarming way or non-scary way. So tell the patient what is the complication and how we are going to avoid it. This will be the way to counsel the patient. If you need further investigation, you need to explain why I need this investigation. And you have to arrange a specialist review to detect what is the next step. So if you have diabetes, you have to refer her to the specialist, which is the endocrinologist. If you have Charcot-Marie, you have to refer her to the nerve specialist or the neurologist. In any condition, you have to refer her to the specialist. The specialist is one of the safety points in each task. As I mentioned before, you have to explain or present the risk in a balanced way. Don't present it in an alarming way or hierarchical language. Please do not tell the patient in the exam you are not allowed. You must, you should. This is a judgmental, this is a forcing language which you should avoid in the exam. Always use you may wish to consider. You may wish to consider vaginal delivery if you are symptom-free. You may wish to consider cesarean section if 1 and 2 and 3. So this is the way how to explain the patient their options and how to counsel her. This way, you will include the patient in the decision making. Always respect the patient preferences in any decision or any intervention that you are going to do over the patient. You are not allowed to do any intervention on the patient without her wish, without her consent. You have to respect the patient autonomy after clear explanation of the risk. You have to explain this and show that you recognize that the patient is the ultimate decision maker. Signpost the patient, signpost before the sexual history, signpost before giving bad news, and signpost for further information or sources of information like the patient information leaflet or the support groups. Give the patient always time to think about her options. Don't ask the patient to take her decision now. And if you have time, if you go in an organized way, please believe me, any task in the part 3 can finish in 7 or 8 minutes maximum. So if you have time, summarize the consultation, make clear plan of the next steps. Please do not forget the follow-up appointments and the referrals. Please do not forget to mention these points early in your agenda. You can summarize the consultation at the end, and you can put all the points of the consultation in the agenda, which I'm always asking the candidates to mention each point in the agenda, because if they run out of time, the examiner and the lay examiner, they will write in their final comment, this is a competent candidate, but he ran out of time. So the last domain, which is applied clinical knowledge, and you will be surprised when you know that even the lay examiner can evaluate you in the clinical knowledge in some domains, but it will not be about the medical part. It will be about how to explain with empathy risk factors of certain condition and the prognosis of her condition. This is the part where the lay examiner will evaluate your clinical knowledge. He wants to see how empathetic you are with the patient, how reassuring, and how you will counsel her regarding the risk factors of her condition, and how you will counsel her regarding the prognosis of her condition, either it's a good prognosis or bad prognosis. Always, if there is any condition that will have coping strategies or other form of treatment that not including medication, definitely the lay examiner will share in the evaluation of the clinical knowledge. Even if the lay examiner marking sheet is not including the patient safety and the clinical knowledge, these points will be added here under the communication and the information gathering. So the lay examiner marks are almost 1/3 of your marks in the exam. It doesn't need much study from you. All the points here are a gift for you. Just remember these points, put it in front of your eyes while you are practicing in the next few days with your study partner. Act, don't feel embarrassed. Act and follow these rules, and definitely you will collect these marks in the exam. It's a precious slide. It's a gift for you. But in exchange of this gift, I'm always asking you at the end of any lecture, if you find it useful, to pray for me and for my family. In all the previous lectures, I was asking you to pray for me and my family, which means my wife and my daughters. Today, I'm asking you to pray for my big family, for my brothers and sisters, for my daughters and sons who are killed every day in Palestine. Please pray for them. This is the least thing that we can offer them at this moment. Thank you so much. Stay safe and wish you all the best of luck in your exam. Wassalamu alaikum wa rahmatullahi wa barakatuh.